story. Health worker union, that's Hospersa, and its federation Fedusa is calling for Tygerberg Hospital in the Western Cape to shut its doors. It claims the hospital is being reckless and is in violation of COVID-19 protocols. They say their inspection shows that the hospital could become a breeding ground for COVID-19 infections. Meanwhile, the Western Cape remains the epicenter of the virus in South Africa. For more on this story, we are joined by Rifda Ajam. She is Fedusa's General Secretary, joining us via Skype from Cape Town. Ms. Ajam, thank you very much for your time. I just want to capture a bit of what you say in your hard-hitting statement. You mentioned that you came across what you described as a casual movement of a deceased person who had just died of COVID-19. My question to you is, how was the handling of this body after your observation thereafter?
Good morning to you firstly, and thank you very much for having us once again. I think it's anybody who would be encountering a situation like that would be mortified. The controls, or the lack of controls in particular, at the hospital on entering the premises has simply been completely deficient. No screening, no testing, not even any glimpse of trying to cover up the fact that somebody, like you rightfully say, had passed on during that time. And for one to be able to encounter such a situation would leave you on a complete back foot in terms of what measures have been put in place to give the general public, as well as our members at the hospital, a sense of security that the national protocols and the occupational health and safety measures at that very institution are being tended to. But unfortunately, the sad reality is it is glaringly absent.
Yeah, late last month, Rifda, that hospital, Tygerberg, it was reported that there was about 105 staff members who had tested positive for COVID-19. I want to ask you what the rate of infection is now, if you are aware of the recent numbers.
Well, just to give you the shocking statistics, at that stage you quote 105. It is now standing at 308 active cases where people have been tested positive at the institution. And here I talk specifically about the personnel that continue to be operative in the hospital, assisting patients, working, and unfortunately, with the glaring lack of PPE on site and the very necessary fundamental measures that should be considered as non-negotiables continues to be absent. Henceforth, the statistics have increased threefold as we speak.
And the morale of staff members?
You do not want to be in the situation that the staff members are in. You are listening to voice notes, you are listening to frustrated members, you are listening to the pleas of staff who are treating people on site. You are listening to staff members who are absolutely desperate and crying out for help. And unfortunately, the government is doing very little, the Department of Health in particular, to allay those fears, to ensure that the relevant materials are in place to give our very frontline personnel who are assisting those who are desperate at this point in time absolutely no sense of security for them to be able to continue to do what they are doing, and that is to help those that are in need during this period of COVID-19. So it's a shockingly sad situation right now.
Ms. Ajam, the Tygerberg Hospital is the second biggest in the country. What you've described in the last few minutes talking to you, I want you to tell me what it tells you about the state of readiness of the Western Cape province in terms of its healthcare facilities, particularly with the rising numbers of COVID-19. And I ask you this on the back of the Health Minister, Dr. Zweli Mkhize, who was there for a whole 2 days inspecting the health facilities. Did he have anything to say about Tygerberg?
Unfortunately, there has been a number of institutions that the Minister has visited during the course of his presence in the Western Cape yesterday. One of those institutions being the Hospersa Hospital, that we have also brought to the attention of the Department of Labour for inspections to be carried out. And the shocking reality at that institution requires us to have a conversation within the next hour once again. But unfortunately, the sad reality of the situation is that Tygerberg Hospital, as you rightfully say, being the second largest public hospital within South Africa, is unfortunately a test case. It is a test case that says to us in absolutely no uncertain terms that we are simply not ready to be able to deal with the structural policy changes that will be brought about by the National Health Insurance. If it is anything to go by, you'd be running for the hills right now. And on the back of the fact that the head of department in the Western Cape makes the announcements that they are going to be relaxing the protocols in terms of the age factors, where people under 55 will no longer be subjected to testing. We ask ourselves with absolute dismay right now, what gives this province the leeway, the right of way, as the epicenter of the COVID-19 pandemic in South Africa, the right once again to determine how we are able to deal with this matter. There are a plethora of inaccuracies, inefficiencies that are marring the system, and to add insult to injury to this process, the ban on alcohol has been lifted. So you ask yourself the question, if we have a state institution that is already so overwhelmed, the personnel is overwhelmed with a number of infections and, people that are coming and reporting to the hospital, how will we be able to accurately reflect the statistics? How will we be able to accurately determine who is subjected to testing and who not? Which essentially means that the data that is being collated and how we respond to the data will simply be completely deficient to all the protocols. And yes, I can undoubtedly say that if this is going to continue with the irresponsible and reckless policy decisions that are being communicated right now, we will definitely see a second wave of infections that the President and the Minister of Health have been cautioning South Africa against. So I fear for what is happening right now.
How soon do you want the shutdown? Very briefly for me.
With immediate effect. It's not a question of if, but when this needs to happen. And we have made constructive inputs by way of the chamber through our representative unions that are sitting in chamber, and we have indicated that there should be a progressive move of shutdown of the units within the hospital in a systematic order, case-by-case scenario, to ensure that currently where you are seeing that the ICU unit within this critical hospital is located just one unit below the isolation ward. How is that on heavenly earth possible? We are setting ourselves up for absolute disaster, and it is a situation that we have to avert at all costs, because we are just disappointing the people of Cape Town every single step of the way.
Rifta Ajam, thank you very much for your time. Fedusa's General Secretary, not mincing her words there.